Finance Officers Association's training, Personnel Budgeting in a Recession. This webinar is approximately 1 hour in length and is worth 1 continuing professional education credit based on a 50-minute hour. All participants' connections have been placed on mute to prevent any background noise. If you have questions throughout the presentation, you can submit them using the Q&A feature in the pane on the right side of your screen. Staff members from GFOA's Technical Services Center are standing by to reply. At the conclusion of the event, you will be redirected to a short survey to evaluate the content of today's presentation, and CPE certificates will be emailed to all paid participants in approximately 2 weeks. So we wanted to get that information out of the way, and we will move forward with our presentation for today. So today's speakers are Mike Nadal, who's a partner at PFM. Mike provides strategic, quantitative, and analytical support for collective bargaining and human resource reforms on behalf of public employers. He's served as Deputy Mayor, Director of Labor Negotiations, and Director of Finance for the City of Philadelphia, and has also served as an advisor to GFOA's Budget Committee. We also have joining us Bob Ikem, who's the retired CFO for the City of Boulder, Colorado. He was also GFOA President in 2014 to 2015. Bob has over 40 years of local government finance experience and has also served on the GFOA Debt Committee. We also have Shane Kavanaugh, the Senior Manager of Research here at GFOA. Shane leads all of GFOA's research efforts and is the author of numerous books and articles, and he's a frequent speaker at conferences across the US and Canada. And my name is Katie Ludwig. I'm a senior manager here at GFOA. I work in the Research and Consulting Center, doing a little bit of research, a little bit of consulting, and a little bit of training. So I will be kind of moderating today's session. So let's talk about the plan for today. So plan for today, we're going to go over some fundamentals of containing personnel costs. We'll go over some primary treatments and then have the panel really discuss some key questions about those. And then we'll go into cautionary treatments. These are a little bit riskier treatments and really want to be careful about how you apply those. So we'll go over some key questions related to those as well. And then if time allows, we will also answer questions at the end of the presentation. So before we dive too deep into the treatments, I did want to give a quick overview of kind of where these treatments fall in relation to our 12-step fiscal first aid continuum or process. So these fall into here step 5, what we call our near-term treatments. So you don't want to necessarily jump right into these. You kind of want to go through the process, but you can really learn much more about all the different steps on our Fiscal First Aid Resource Center page. So if you go to www.gfoa.org/FFA, we've got lots more information on all these different steps, and lots of resources to go along with that. Shane, did you have anything you wanted to add here?
No, I think it's well said, Katie. Maybe also just the only thing I would add perhaps is that these treatments that we're talking about here today are, I think, really focused on the shorter term, meaning they're on the left-hand side. We're kind of figuring out, well, how do we stabilize the situation and prepare ourselves for a strong and full recovery in the end.
Great. No, that's a really good point. Mike, can you start us out on the next slide? We're going to kind of talk through some things we need to keep in mind here in terms of the fundamental equation that we need to be keeping in mind as it relates to personnel costs.
Sure. Thanks, Katie. So the math here is simple enough. When you're thinking about workforce costs, and as you know and live with every day, they're typically the lion's share of the operating budget for labor-intensive local governments. It's really a matter of how many employees you have and how much are you spending for each employee. So as you think about cost containment, cost control, or as necessary, cost reduction, it becomes a matter of looking at the size of your workforce and the different tools and levers you have for potentially reining that in. And it involves looking at the mix and type of employees you have relative to their cost, and then what are the pay and benefits and other associated supporting costs for everybody that you have delivering those critical public services. And as you turn the slide, some of the other important frameworks to have in mind as you address these issues involve, for those of you in collectively bargained work environments, what are those limitations? Is there an expired contract? What flexibility, if any, exists to modify terms during or at the expiration of a contract? What are the rules of the road in terms of the changes you can make both within and outside of collective bargaining? And how can you engage your employee representatives, even if they're informal representatives in some types of communities, to be part of what needs to happen in a difficult period as opposed to an obstacle to change. One of the key issues to further think about, and I'll note it's extraordinarily challenging with the recession that we're facing now. One of the key issues to think about is how long do you anticipate the fiscal strain to last? And do you need to make structural changes that will recur year after year after year? Or can you manage and navigate your way through fiscal pressures of shorter duration through one-time measures or otherwise temporary types of steps? So we'll talk in a little bit about the option of unpaid furlough days as one way of addressing workforce costs. That can sometimes be a little easier to navigate in a collectively bargained environment because while it is a sacrifice for employees, it's not one that affects compensation for the long haul. On the other hand, it doesn't continue to generate savings for the long haul. And if you, in the alternative, look at something more structural, like a change in health benefits, that can have not only recurring, perhaps compounding savings because of the long-term challenges of healthcare inflation, but potentially more of an adverse impact on employee relations, potentially, depending on the type of change you're making, have recruitment and retention implications as well. So finding that right balance and thinking about in that unionized environment, are you looking for the stability of a long-term deal or the flexibility of shorter-term one-year contract periods or reopeners that can help you within the rules of the game make changes in a timely way and with a particular, again, degree of uncertainty we face with this economic downturn. In most cases, I think having that kind of flexibility should be a priority to help manage the pressures we all face.
Thank you, Mike, for framing that for us. I think that makes a lot of sense and is kind of, again, helpful to keep in mind as we are kind of going through these different treatments, these different possible avenues we can go down. So first thing we're going to talk about today are what we call these primary near-term treatments. I'm just going to go over these quickly so we can really get into discussing more of those key questions. But the near-term treatments, these, again, are a little less risky than what we're going to talk about later. They're really based on proven financial management practices and are really things that you don't have to necessarily be waiting for a crisis to implement them. They are useful. They're good practices in general. They're utility increases as you're facing a fiscal crisis, but they really are just good all-around management kinds of things. So you can see there you can do things like reviewing the use of consultants. We're not going to talk too much about that one today. We're going to talk a little bit more in greater detail, though, about, again, vacancy control, monitoring, limiting overtime, and then addressing healthcare costs. We'll go into greater detail on those. So we'll start with vacancy control. So here, the one thing I want to mention is I think a lot of us probably do have already sort of regular position control kinds of checks and balances in place in your organization. You might need something even more rigorous to be put in place if you're trying to achieve a given amount, a certain amount, if you're planning on a certain amount of vacancy savings or attrition savings. You might need to, again, be a little bit more rigorous than what you might do on a day-to-day basis and under quote-unquote normal situation, normal circumstances. But really this just entails reviewing all vacancies before they are approved to be filled. You might want to set criteria around that, like what types of positions will be approved and when they'll be approved. Really being clear about that, being clear about what the sort of criteria and the rules are for that really can help you in terms of getting that internal buy-in that you're going to need. So we are going to go over key questions related to vacancy control, but first we have a poll question for the group. So our poll question here is, does your organization currently use any form of vacancy control? So got simple answers there. We have a no, a yes, or we're considering implementing vacancy control. So if the audience can respond to that, and meanwhile, while we're waiting to see those responses, we'll kind of move into some of these key questions. So Shane, do you want to start us out here and kind of talk through what controls need to be in place to make sure vacancies aren't filled before they're reviewed?
Sure. Yeah, I would have to, Katie. Yeah, first I'd like to echo something that you said is that, well, I think, many folks probably have a some sort of position control feature in place. Maybe in a more normal times it was set so that once the budget is approved, departments just went off and filled vacant positions, of course, with the cooperation of the HR division, but largely proceeded on its own. But as we enter this sort of era of a downturn, rethinking that a little bit and thinking how you might centralize some of the decision making on whether or not to fill a position could be very useful. So, for example, the HR division will, of course, probably be the first place to know outside of the department that has the vacancy when a vacancy occurs. So using that point of contact to put the stop on filling the position. So before it's advertised, really think about how do we go about approving that position and making sure that it's something that is really necessary and something that is within our means to pay for in this time. And I think, Bob, you are going to jump in here with a little bit on some of your thoughts on who should review and make that decision. Exactly.
Yeah, thanks, Shane. What I've learned over time is that, of course, it depends upon your organization, how you're structured, how large you are, how small, but all of it, overall, what I've seen, no matter what it is a communication of who's going to make the decision, how is that going to be done. And example, in a smaller entity, it may be, if you're a city manager form of government or a mayor form of government or a small school district, the CEO may make that decision and may have input from others. It depends if it's a top-down structure or more team-oriented. So, interesting enough, over the years, I've done all of them, and various degrees. And the ones, though, that are working more nowadays, that I've seen work really well, are having teams, which includes staff support members from HR, from finance, budget division, but also they are then recommending to the CEO what positions should or shouldn't be held, what the criteria will be, what the steps are going to be. So it differs depending on your organization. I'm not saying one is the way you should do it, but be very clear in communicating to all of your departments or your agencies or your bureaus, however you're structured, that this is what the process is going to be, when it's going to be, and how long it will be before you receive information, because some positions are so critical, you may need to fill those, whereas many others, a greater percentage, won't be. And that leads into, of course, other questions of, is this a temporary thing of, you're not going to fill this position, or you're eventually going to eliminate it, and that's going to depend a lot of it on the depth of what the recession or depression you be going through.
Yeah, and then maybe I'll just kind of lead into that next question there. I think Bob, with the criteria, Bob made some really interesting points about using a team and making sure that people understand the process. And those are, I think, just good things to do by themselves, but also beyond that, help make the entire decision-making process about deciding which vacancies to fill and which not to fill a lot more fair to people. So people feel the process is fairer if they have kind of some input on a team and if the process is made clear. And then beyond that, having criteria defined to how to fill a position. And on the slide, we have a number of different criteria, and I'll just speak to those. So we've mentioned criticality, and I think the key there is having what I've heard described as comparative context for making these decisions on which positions to fill and not to fill. And what we mean by that is what happens if the position is not filled? What's the real impact, and how does that compare to goals that the organization has set for service provision? So just to take a simple example, if you have goals for coverage for, like, say, emergency services or response time for fire or whatever, how would a vacancy impact your ability to achieve those objectives? The next point we've got there is avoidable costs. And what we mean by that is that if a vacancy is not filled, there may be circumstances by that all that money is not necessarily going to be saved, with the most simple example being if you have a service that requires constant coverage, and if you are missing a person, you may have to pay others overtime to make up the gap. So that means that the full cost of the vacant position is not avoidable. And as part of that, you're thinking about focusing your analysis on funds that are in trouble in your organization, because I think Mike made a great point earlier, is that you have to understand the true nature of the deficit. How long is this expected to last? How deep is it going to be? But also as part of that is which funds are really experiencing the most trouble. And sometimes positions that are in funds that are experiencing a lot of trouble there's going to be a greater case for that position being left vacant. And you might even think about, well, if a position is shared between multiple funds, if one fund is doing pretty well, it could be, maybe that position should be shifted completely into that fund. If that fund needs it and that fund can afford to pay for it, maybe that's an option. Maybe that's something your team that is evaluating this could consider. Moving on from there, we say on the slide, we bring up lost revenues. So just very simply thinking about this is a position that is involved in collecting revenues. May not be a great idea to leave that one vacant if it's going to lead to lost revenues. We also mentioned increased costs. So a pretty good example there is overtime. So there's some cases where having the position might result in might result in more OT having to be incurred. But there's other things, like maybe there is certain staffing requirements that you need for, like, a piece of fire equipment, or to staff a station properly. And if that doesn't happen, you're going to have all sorts of downstream negative effects that you might have to think about that have cost implications. And then lastly is contractual and mandated requirements. And we're getting at there is that just really thinking about what do the mandates really say. So, and many times I think in local governments, the excuse is to perpetuate or continue spending is sometimes that, well, it's mandated, end of conversation. But a lot of research has shown that the mandates are often exaggerated. So going back to that mandate and reading what the letter of the law says can be very informative. Just a real quick story on that is one county government that was experiencing financial distress was looking to make some cuts in the sheriff's office, and the sheriff's response was, well, sheriff is mandated, you can't make cuts. And so they read the letter of the law, and the letter of the law just said, you shall have a sheriff, which is a guy with a badge. So one guy with a badge is a lot different than like helicopters and drug sniffing dogs and everything else. So really looking at the law in that case helped, we'll say, clarify what was mandated and what was not, and opened up some flexibility that maybe perhaps wasn't perceived to be there before. And then maybe I'll go on to that next bullet, is appropriate use of savings. Real quick there, I think pure vacancy savings, meaning if these are savings like, hey, you know, this is a vacancy, it's temporary, we're just stretching the vacancy out. I think treating that as a temporary revenue makes sense. If what we're talking about here is part of an attrition strategy where you're saying, well, we're going to actually shed the positions in the aggregate, we're just using natural attrition as a way to get there, then I think there's a stronger case for treating those revenues as an ongoing savings. But I think the point being, as part of the review that like Bob and Mike are talking about with thinking about the depth of the recession, having that in mind, is this a temporary sort of savings that we have to use for temporary costs, or is this an ongoing thing that's going to help us reach structural balance? And I think Mike made that point well. And speaking of which, Mike, I think you were going to take that next question there.
Sure. So all of us who lived through the Great Recession or prior downturns would probably cringe if asked to, quote, do more with less. We've all kind of been there, but at the same time, I suspect that many of you have success stories of how you were able to achieve that. And with changing technologies and changing times, better communications tools, there may be opportunities as vacancies arise to rethink particular areas of service delivery, to come up with cross-training opportunities for frontline staff, or as you see here, to look at span of control for supervisory positions as they come open, and to rethink whether or not you need to have the exact same configuration of supervisors that were historically in place due to perhaps really, terrific career incumbents. Maybe with somebody's retirement or attrition, that gives you the opportunity to think about having the person who's doing something else parallel within the organization take on responsibility for a somewhat broader span to help manage the long-term costs of the organization. And there's a lot of literature around this. There are states like Iowa and Texas that have been doing span of control work for years. What you'll see, even where states like Texas have target levels of an 11-to-1 supervisor to employee ratio, that what you really need, as illustrated here, can vary quite a bit depending on the type of organization, function, schedules, complexity, geography of what you're doing. And there really isn't a one-size-fits-all perfect ratio for determining how many individual frontline staff one supervisor can handle. But it's absolutely a question that can be asked when those types of positions become vacant. And that's often where proportionately an even greater level of savings is attainable, because those will tend to be somewhat higher paid employees. But the overall goal, whether it's the frontline cross-training or the supervisory spans of control, is of course to minimize the impact on your services as if you have to reduce the size of your team.
Well, thank you. Thanks, guys. I think that was a great overview of some of the, again, kind of things to think about. Keep in mind as you were, some of our listeners might be considering a vacancy control program or initiative. But now we are going to jump ahead into monitoring and limiting overtime use. And I'm just going to kind of go over this really quickly again, so we can get into more of those questions. I feel like that's really helpful for everyone. But again, as we know, this can kind of be a tricky one right now with overtime. We know that there's the COVID crisis might be triggering more overtime for your organization. But again, these are some things that you might want to consider if you are seeing this is creating different schedules, again, looking at part-time staffing to supplement your full-time folks, managing employees who consistently have a lot of overtime, right? Sometimes you're seeing that this is a trend with maybe a person or a handful of people, and there might be something that needs to happen there. Again, managers need to talk with them about that. And then again, clarifying kind of policies and procedures, creating guidelines, that's really important too when it comes to overtime. It's really hard to, hold people accountable, hold them to the rules if you haven't established what those rules are first. So again, we'll jump into some key questions here. Again, Shane, if you want to get us started off, do we think overtime is cheaper or more expensive than having more employees, and how do you kind of do that math and figure that out?
Sure. Well, thank you, Katie. So I think that kind of the key idea with this question is that I think to some folks' ears, right, when we say overtime, that sounds like an expensive thing that we ought to have less of. But in some cases, right, it may actually be cheaper to pay overtime than to hire more employees to cover the schedules that need to be covered, right? Because when you factor in things like benefits, equipment, special training, the kind of fixed costs, if you will, of having that employee are actually pretty considerable. So paying that same employee a little more overtime, which is a variable cost, even if it's a higher variable cost than, say, an hourly wage, is actually cost beneficial. And what becomes important, and I'm going to ask Bob to jump in here, is really where the controls then on accruing overtime become, where it's really very important to start thinking about.
Thanks, Shane. Yes, example from my past is, okay, we won't pay overtime, but we'll give comp time. Well, now you've had these layoffs, and so people are doing more work than they ever did before, and they decide, well, I think I'll go someplace else. Well, now you have to pay the comp time anyway, so you really didn't save the dollars. And you got to be very careful of the unintended consequences. And one of these things are the items already covered and of the things we'll be covering are unique. We as budgeteers must understand the business that our various divisions, departments, bureaus are in, because they are different. So the controls in a police department may be very different than a fire department, even though they're both in public safety. Fire runs on 24-hour schedules usually of some type, and police are different. Same with your public works employees. So main thing on the controls is going back to the communication aspect. There are always stories out there that we hear whenever we've done budget classes. But, well, we were in this meeting and this is what we decided, but the results were that everybody was doing it differently. And the problem there is who is going to be responsible for monitoring this? Are we so large we need to have a backup on that? If it's going to be in the individual division or departments, who is that person going to be? And very clearly they need to be written out, because you get into contractual obligations or even your own financial policies regarding overtime. So the best is if in your HR systems or usually your payroll systems, the accruing of overtime is at that point, and that is where you can continuously go to grab the information once it's been implemented. And some of them, and I know in the very small entities that I've been fortunate enough to visit over time, is it may be still that you're doing that on an Excel spreadsheet and keeping track of it. But the main thing is who is keeping track of it, and when is that going to be reported on, and how, if something's going wrong, who's going to be the contact person with that department or division. Thank you.
Thank you, Bob. And, I think something I want to pick up on what Bob said is kind of knowing the operations of the department. And some of those, knowing that operations often requires collective bargaining agreements or mandates. And I mentioned earlier the story about mandates and knowing what the mandates really say. So my point here is really essentially the same thing, but applied to collective bargaining contracts, because the same exact thing can happen where urban legends, if you will, start to arise about what the contract requires, and a reading of the letter of the contract can often be very illuminating to what is required and what has just become urban legend over time. So there might be an opportunity to change those practices without actually having to change the contract. And I think with that, we're going to hand it over to Mike, who is going to say a little bit about some other ideas for controlling overtime.
Thanks, Shane. Yeah, so a couple of things to think about in terms of overtime control strategies. One is your unscheduled leave usage, and I'll acknowledge changing those types of behaviors can be a little bit difficult to do quickly. So in the midst of a sharp downturn like we're experiencing now, it can be a bit challenging to flip the switch. But over the years, we've seen a lot of local governments have significant success with restructuring their injured on duty programs in ways that can help get employees with manageable work-related injuries back to work more quickly. We've also seen more effective sick leave control and sick leave policies be developed that can reduce unnecessary leave, perhaps through a paid time off program or that sort of thing, in ways that still protect people's need to take time off for legitimate illnesses. One thing we've learned in our recent experience with the coronavirus is that you don't want, when you return back to working environments, you don't want sick people showing up when they ought to be staying at home. But still, those are areas that can reduce the need for those unplanned replacements that drive overtime. Work processes are also important to look at, consistent with some of Shane's comments about work rules and whether collectively bargained or otherwise. And thinking again about the current environment we're in, many communities with law enforcement personnel have actually seen significant reductions, of course, from court-related overtime, in part because the courts have been shut down, but also in part because ongoing court operations have shifted to greater remote coordination, advanced telephonic or virtual coordination to reduce what can often be a real burden on a local government budget to have your police officer on your dime sitting in the hallway waiting for a court hearing that might never really happen. And the hope is that not only can that carry forward in the current environment, but that as things return to normal, we can take some lessons from this experience, improve the work processes, and use that to help manage long-term costs.
Thanks. Yeah, Mike, I think that was a great point to that. This current crisis has kind of thrust us into a world where we've had to test things that we've never done before. And, I think the hope is that maybe some of them that are working will actually stick around because they've, we kind of had this time to test them out and experiment a bit. So I think that's a really great point. So the other thing we're going to talk about is addressing healthcare costs. So again, we've highlighted here a number of kind of reduction techniques that won't necessarily reduce employee benefits. We think those are, again, less risky when you're not reducing employee benefits. So you can see we have a number of things listed here. And these all might not work for your organization, but these are, again, just things to consider. I should mention we also have on the web page for this course, we have a lot of supplemental resources there, and we have two different articles posted there related to eligibility audits and sort of self-insurance, self-funding healthcare insurance. So check those out as well. And then let's jump into some of these key questions here. Oh, sorry, we have a poll question. I forgot about this. I should mention the last poll question. Overwhelming majority of folks that responded said that yes, they did have a vacancy control program in place. So this one is, again, before we jump into our key questions, we are going to say, has your organization recently taken any steps to reduce healthcare costs? So no, yes, or we're exploring our options for reducing those. So take some time, fill that out, and then now we will jump into our key questions for the group. So Shane, I kind of gave a preview of this. Sorry, I didn't mean to steal your thunder, but what can we say about eligibility audits?
Hey, no worries, Katie. Yeah, so eligibility audit. So number one, if you aren't familiar with an eligibility audit, the basic idea is, hey, let's see who we're paying for on our health plan and make sure they are actually eligible for these benefits. Because it's not uncommon to have folks like maybe a divorced spouse of an employee, meaning their old spouse has had divorced is still on the plan, or maybe children that have gotten too old, things like this. Not uncommon to have those folks being carried on the health plan. And so there's an opportunity to identify who those folks are and remove them from the plan. And this is important because dependents typically represent a majority of covered lives on most healthcare plans. And we actually did some research on this a little while back here at GFOA. And our research showed that the median number of ineligible dependents for larger governments was about 6%. And if you think about that, 6% of dependents ineligible, that's going to be a fairly big chunk of change. And that number was also fairly stable, meaning that 6% fairly stable for the governments that we looked at. So they grouped around 6% pretty consistently. And then when we look at smaller governments, because they're smaller, you're going to get more variation. But in that case, we found a range, a wider range, where you've got a range from about 3.5% of dependents being ineligible to about 12.8% of dependents being ineligible in the sample that we took. So I think that's pretty interesting. It shows that there is not an immaterial number of dependents that may be ineligible for your plan. I think this is important, right? Because if they're ineligible, they're not getting coverage anyway. So it's not like you're kicking them off the plan. They were never really on it to begin with, because once you go to draw on it, like folks, it's going to be found out that, oh wait, they're not really eligible for this. So it's, I think, a important thing to look at. And then the other point I'll touch upon on this slide is self-insurance. And the idea with self-insurance really basically is that you're going to cut some of the costs associated with private insurance, like profit, and the cost of complying with certain legal and tax mandates. And also maybe an underappreciated benefit of the self-insurance is that you have more flexibility to implement certain cost control techniques. So for example, you're able to do better claims monitoring. If you're able to do better claims monitoring, you're going to be able to do better disease management, which I know Mike is going to talk to in just a minute. And if you're maybe too small for self-insurance, or you just haven't thought about it, pooled options might be good. So working with other local governments to do a risk pooling for for health insurance. Those risk pools are often essentially giant self-insured pools. So you get the benefits of self-insurance, but without having to necessarily go it alone. And as Katie mentioned, we have articles on both those topics at the course website. One, we've gotten the slide there, Controlling Healthcare Costs and Dependent Eligibility Audits, and the article about self-insurance as smart practices for self-insurance. So if you are self-insured now, that article walks you through like a checklist style list of options that you can explore to make sure you're getting the most out of your self-insurance design. So with that, I'm going to ask Mike to jump in here to talk about the redesign and disease management points.
Sure. So what you want to think about here is just how are your employees using their healthcare benefits, and are there some who are using them in ways that don't adopt a kind of consumerist focus. So what do I mean by that? If you do analytics of what your experience is and find that relative to other similarly sized organizations in your community, your folks are going to the emergency room much more frequently than would be expected, it may be worth revisiting what is your copay for emergency room usage versus your copay for urgent care. Or for other more routine ways to access telemedicine, which is now much more familiar to many of us, again, in the wake of COVID. And by and not necessarily shifting a significant share of total healthcare costs, let alone premiums, to employees, but simply by tweaking the incentives within a plan to bring yourself and your experience across your employee base more into line with good practice and a consumerist point of view. You can sometimes achieve really meaningful savings while still maintaining a very affordable competitive cost structure. Likewise, with disease management, I'll just note that's a great thing to explore, regardless of your size, with the different partners you have in benefit service delivery. A lot of your costs are going to be concentrated in folks with chronic and more troubling health conditions, and programs like diabetes management and control can be great for your workers' health and beneficial for the bottom line cost of your coverage as well.
I'd just like to add that in self-insurance, one of the things we aren't talking too much about today is the use of consultants. And this is definitely an area, if you don't understand it completely, I really strongly suggest get a good consultant who understands the business, what it does, how it works, because it's sometimes a real challenge funding those reserves at first, and people have ideas on how to do that.
Yeah, thank you. Maybe I'll just add one more thing there. No, it's fine. Mike mentioned the savings from disease management. Just was reading a study last week about, I think the ROI from disease management was about $3.50 for every dollar invested. And it was compared to like your more traditional wellness program, which is actually 50 cents return for every dollar invested. So I think disease management, very serious opportunity.
That's good to know. Interesting stuff there. We are going to shift slightly now to talk about the cautionary near-term treatments. So we have quite a few of these to go through, and I'm looking at the time, so I might go through some of these a little bit quicker. But again, as the name kind of indicates, these cautionary treatments are a bit riskier. There are times though that you may have no other choice but to use them. You know, you're in severe financial distress, you might have to move forward with some of these. So we just really kind of want to go over them and again, kind of talk through so that you're aware of those risks and can maybe put things in place to kind of mitigate those. Go in with your eyes wide open, so to speak. So the first of those that we're going to talk about really are layoffs or reduction in force, as it's often known as well. So again, sometimes you just need to cut employees. This can lead to significant cost savings, but has some risks, right? It's often related to morale and then impact on service quality, potentially. So let's kind of talk about some key questions here. Again, this is a big topic, I feel like. So Mike, do you want to get us started and kind of talking through the full accounting of all savings and costs?
I do, and I also actually want to note one other risk of workforce reduction through layoffs, which is that you'll typically have a last in, first out kind of seniority-based policy, which can affect your pipeline of future talent and can even have an adverse impact on diversity within your workforce, depending on your kind of historical hiring experience. So it's often not the way you want to go, but if you do have to do it, you want to make sure that the numbers add up. And it can be a little bit trickier than you would think. While the initial savings from laying off somebody, eliminating their salary, the associated benefit and roll-up costs is hopefully relatively clear, sometimes overlooked are separation payments for accrued unused leave, longer-term or multi-year impacts on unemployment insurance costs, depending on what type of unemployment coverage and plan you participate in locally or within your state. So there are some hidden costs to watch out for that can erode some of the top-line savings you might initially be looking for. Related to that, early retirement incentives are sometimes proposed as another way of shrinking the workforce. And again, it can be a tool and it can sometimes work, but also has a lot of hidden costs. You'll likely be providing those incentives to some people who would have retired anyway. So you're paying out more with no direct benefit. There can be, if it's a pension-driven incentive, it can have longer-term effects on your employer contributions to the plan. You may be accelerating the timing of when you would be paying for retiree health care if that's a benefit you offer. And again, those one-time separation payments may be present. So getting the numbers right on these workforce reduction strategies is important, and it often can illustrate that you have to cut deeper than you would have thought at a first blush analysis.
Yeah, and maybe I'll just jump in there. I think, Mike, a good point with the ERI design, and I think it relates to that last bullet with attrition, is also thinking about if you've got an attrition strategy where the ERI is like, well, we're just going to stop having, we're going to have less positions after this is all done. An ERI is going to be more cost beneficial than if, well, we're just going to fill it with more junior people because, right, those junior people will probably be making less, certainly, than the more senior people when they start, but the benefit cost will be more or less the same in terms of like healthcare and that sort of thing. The wages will go up over time. So to Mike's, I think, earlier point, is that the long-term savings ERI and whether or not you're using as part of an attrition strategy would have, I think, some definite implications in that way. But with that, Katie, I think, we've probably covered this slide. So in the interest of time,
yeah.
I think we can move on.
So we will talk through wage freeze. So again, we touched on this a little bit briefly earlier, but this can help control costs going forward. There's a lot of risks as well, kind of not only the, again, morale, but can make it harder to recruit folks. Again, the collective bargaining environment needs to be taken into effect, or into consideration, excuse me. And again, this is, if you're trying to take a really results-oriented or data-driven approach to what you're doing, it's kind of hard to do that with a wage freeze. This is really just such a blunt instrument. It's hard to be more surgical. So, Mike, you were going to walk us through some key questions here.
Sure. So in addition to the competitive dynamic, what are others doing? How much of an impact might this have on your retention or recruitment? You do want to be thoughtful about the cost of living pressures your current employees face. Mm-hmm. The good news is, if you want to call it that, I guess it's a silver lining at best, is that in recessions you typically do see lower inflationary pressures, and we're so far seeing that with declines over the last several months and year-over-year CPI gains that are effectively flat as of May. So if that continues, it does at least moderate the negative impact of wage freeze or a slowdown in wage growth. The other thing to think about is, to what extent does your pay structure have steps or merit pay or automatic longevity increments such that your employees, or at least a significant percentage of your workforce, may be experiencing some wage growth independent of an across-the-board increase. Mm-hmm. If they are, again, that helps to manage the impacts on your workforce of a slowdown in wage growth. On the other hand, steps in longevity growth has a cost too, and sometimes ends up being something you would look at if you have to, as another area to potentially freeze or limit.
Sure. No, that makes a lot of sense. Similarly, again, hiring freeze, a very kind of a similar step here, also comes with a lot of risks. I think Shane and Bob, you were going to kind of talk us through these key questions here, right, in related to a hiring freeze.
Yeah, I think it's very similar to the wage freeze, and that's a blunt instrument. So maybe the top question there is that vacancy control item we talked about first. Do you have opportunities to use that as opposed to a hiring freeze? Because the vacancy control, like we talked about, Bob brought up, like using it in a team approach. We talked about, are there certain criteria you can use to separate the truly important positions from the ones that maybe you can live without? All of that will be a much more targeted and strategic approach than just a broad-based hiring freeze. And I think Bob asked you to jump in here with maybe some additional thoughts in terms of criticality and looking at and avoiding those unintended consequences.
Thanks, Shane. I think the main thing for me is that what I've learned is that first thing we think of criticality, we say, okay, fire, police, utilities, streets. Well, I think that's shifting because of what's going on in our country. And some of it is, I know that the last employer I worked for, there are just as many things in parks and recreation and open space and through the equity lens that we need to look at criticality. So the thing is, what I'm saying is, if you're in a top-down organization, you might be able to say, this is what's going to be the critical issue, what's going to be the criticality that we are going to apply to every position comes through. Realistically, I found that it works much better if it can be the team approach, to let people know how you're going to be ranking these positions, why, and when everything is a priority, nothing is a priority, so it's going to really hurt you to try to make these reductions. So I think the best thing I can say is you must know your entity, you must know your community, and also what's the management philosophy that's to be used. And how you recognize and avoid unintended consequences, the one we often use is Boulder was a home rule city, and many of the cities in Colorado are. And the first thing we'd say is, well, we would hear, well, cut the auditors, the tax auditors, because we can collect our own sales tax. And it was fine, yes, but best to understand that you're also going to give up about $300,000 minimum in auditor revenue for every auditor you reduce. That can have long-term impacts. So the thing is, we can't just be in a vacuum as budget people or in helping our CEOs run the organization. So those are, that's all I'm going to cover in the amount of time that we have. Thank you.
Yeah, no, that's very helpful, Bob. I think those are, particularly your comments on the kind of the equity lens that's becoming more common in budgeting. I think that's really helpful, and it's hard to make that judging the criticality, like you said, a lot harder. And the team approach is really helpful there, I think. Next risky treatment we're going to talk through is increasing part-time labor. We touched briefly on this earlier as it related to overtime, but I'm going to ask Shane and Bob again to kind of talk us through some of these key questions. So, yeah, how do we maybe take into account all the costs related to part-time employees?
Sure. Yeah, I'll just tell a little story here that might illustrate some of this. And so this is about a school district that was thinking about the use of paraprofessionals. And the story was that, well, people thought paraprofessionals, they don't cost a whole lot, not a big deal. How many we have, if we use more, great, And so what they found out as they dug into this budget is that, number one, a lot of the paraprofessionals got benefits, and also the cost of the paraprofessionals was divided amongst various different line items. So when they added up the benefit costs and all the different line items, the paraprofessionals were costing them much more than they thought they were. So I think the kind of lesson there is to be cognizant of the full-time cost, because some people might just see the lower wage in some case and assume it's a good deal. And then also what the in our school district's case, these paraprofessionals were doing a lot of work outside their job description, and that work fell into two categories in many cases. One category being they were underqualified to do it, so that would be like teaching kids to read. They're not reading teachers, so it wasn't getting done all that well, and things they were kind of just overqualified to do, and that wasn't really what paraprofessionals were hired to do. So they were performing like non-value added tasks. But there was the assumption that, oh, the paraprofessionals are doing the things in their job description when they looked at it, not so much doing the things in their job description. So that really speaks to both of those points there, as being aware of the full cost of these part-timers and being aware that they have different training, or maybe in this case, less training than full-timers, and that really limits the amount of value they can add to the organization. And Bob, anything else you wanted to add on that point? Bob, you might be on mute. Or we could take that as a no.
Well, I'm going to move along to our last treatment that we're going to talk about, which is increasing employee pension contributions. So again, it really is more of a short-term solution to your growing liabilities. Could involve any number of things, increasing employee contributions, retiree co-payments, but there are significant risks here, right? So it can compound the burden on the employee. We talked a little bit about that as well as related to wage freeze. It can be not very politically feasible. And again, if you're in a collective bargaining situation, negotiating with organized labor can be difficult. So some key questions here. We are going to turn this over to Bob and Mike.
And maybe just Mike.
Yeah, and the pitch is what can be done in the short term. You really have to understand the and what can be done and what can't be done. Very important up front. And the other one is if you leave those positions open and don't fill them and don't have a lot of reclassifications and use overtime, you may be able in the short term to at least reduce the pension contributions the employer is making because the position is vacant and not being used. And how do you lay the groundwork for long term? I've been fortunate enough to work with pensions since the mid-70s, and both the defined benefit and defined contribution. And to set it up for the long term, you need to go out and talk to employees, you need to understand what their concerns, how it's going to impact them and their families, also the retirees that are out there. Those are the things I'd share.
Mike, anything you wanted to add here?
Just briefly, that with the downturn and the effect that is likely to have and has so far had on the investment markets relative to pension plan investment return assumptions of typically somewhere around 7.5%. There will be a couple of years down the road increasing pension funding pressures for most folks unless there's an extraordinary bounce back. And if you're in a state plan, you may not have a lot of control around that. But if you have your own plan, there will be those who point towards increased employee contributions consistent with this option as one of the ways to address that. And as Bob said, it's really important to step back from just the funding and think about the program as a whole and whether there may be some adjustments that continue to provide a secure quality benefit for your career employees, but that let you get there in a financially more sustainable way. Also taking retiree health care and the whole kind of range of retiree benefits into account. If you do it thoughtfully, you may find some options that can mitigate just the funding part of the equation.
Makes a lot of sense. I want to thank all of you for all three panelists for your insight today. Very, very helpful. We're going to close out here with our poll question number 3. Which of the cautionary near-term treatments listed below do you think offers the least risk for your organization? So which do you think would kind of, make a good fit? It's the least risky. So we have the menu there to choose from. Think about that for a second and then respond to the poll. I should mention the last poll, most people said that they had not taken any moves to reduce healthcare costs, but some folks said that they were thinking about it, and a few folks said they had. So where do we go from here? So we have, again, these are some resources that we are on our Fiscal First Aid website. Again, that's gfoa.org/FFA. We have Balancing the Budget in Bad Times Part 1 and Balancing the Budget in Bad Times Part 2, those 2 white papers. Again, you know, lots of other resources as well. The recording of this webinar will be up probably next week. So share that with your friends. So yeah, if you have, we're out of time for today, so we won't be able to take any questions, but I want to, again, thank all the speakers. There's everyone's contact information. You know, feel free to reach out to any of us if you do have questions going forward. We're happy to kind of talk things through with you, answer questions that you might have. But thank you for tuning in today. And again, thanks to our speakers.